We start tonight at 5 with encouraging news about COVID-19. Our number of cases in Ohio has gone down about 1,700 week to week. Hospitalizations and deaths from the virus are also decreasing. Statewide, those numbers all trending in the right direction. In fact, hospitalizations have steadily gone down now over the last 3 weeks. Just 608 new patients admitted last week. Meantime, 87 deaths were reported in Ohio. That number is down from 98 the week before. Let's bring in senior health correspondent Monica Robbins now. Monica, good to see you. Late this afternoon, we heard that the CDC is changing their COVID guidelines. Somewhat surprised by this. Tell me why they did it and what their new recommendations are.
This is going to make a lot of people happy, Jay, because you know what? It's estimated 95% of us have already had COVID exposure. The CDC, is moving from infection prevention to protecting the vulnerable. So detailed guidelines will be released soon, but the summary indicates screening is no longer necessary for those without symptoms. The quarantine rule for the unvaccinated and those who've been exposed is gone. Those with COVID should isolate for 5 days, and if fever is gone and symptoms improve, they can go back to business but wear a mask until day 10. 2 consecutive negative tests are required before you can take off that mask, and contact tracing only in healthcare and high-risk settings. And if case counts are high, they still want you to wear the mask. Now, cases seem to have peaked, and there is no concerning variant behind BA.5 right now, but the pandemic isn't over. It's just up to us to better manage our health.
Interesting, Monica. Let's turn the page to monkeypox, because that's clearly been in the news the last couple of weeks here. It's starting to spread in Ohio. Today, Summit County reported its first case, which actually is a resident who contracted monkeypox while traveling out of the state. What did our health leaders today say about the virus and how we manage it?
Well, you know, right now, Ohio has 75 cases, including 20 in Cleveland, 1 in Summit County, as you mentioned, 2 in Lorain. There is a global shortage of the Jynneos monkeypox vaccine. So most of the 1 million doses in the U.S. targeted to states with the biggest outbreaks. Ohio is number 21 on that list. Now, the state is advocating for more vaccine, but the current allotment will be about 13,560 doses. It is a 2-dose vaccine, and the FDA just authorized that people can receive 1/5 of a traditional dose. That means our allotment could potentially vaccinate about 34,000 people, but it is not a free pass.
We don't know with certainty if the vaccine is going to prevent people from getting monkeypox. It may be that after somebody's fully vaccinated, they could still get monkeypox, but their case would be milder. So again, we want people to understand this. It's not a free pass if you get the vaccine, whether it be 1 dose or 2 doses.
Now, those doses have to be administered intradermally, meaning between the layers of the skin instead of into the muscle or the subcutaneous tissue like you normally would get a shot. Now, a study by the NIH found 1/5 of a dose given this way provided an adequate immune response, but that was just one study. This method has been used before during vaccine shortages, though. Also, typically with vaccines, it's not about the size of the dose, but the level of immune response. That's important. That's why a 100-pound person can get the same amount as a 300-pound person, and it works for both. And I know that was a question you asked me this morning, Jay.
It was actually a question that a viewer had sent, and when I read it, I go, you know, that's a really good question. Why would they give the same amount to a person that's 100 pounds and the same dosage to a person that's 300 pounds?
Now you understand all those clinical trials and why they're so long. They're trying to nail down what is the appropriate dose that elicits the immune response in people.
And apparently it's the same regardless of size. I did not know that. Monica, thank you very much. Good information.
Sure.